Good afternoon, everyone. I'm Nirav Shah, the Director of Maine's Center for Disease Control and Prevention. I'm delighted to be able to join everyone this afternoon to provide you an update on where we are with respect to COVID-19 for the entire state of Maine for today, Tuesday, March 23rd, 2021. I begin today's update on a sad note. Maine CDC has received reports of 2 additional individuals who have passed away with COVID-19. Both were men. One was a resident of Androscoggin County, and the other of Cumberland County. One was in his 70s and the other in his 80s. Their deaths mark the 730th and 731st deaths among people with COVID-19 in Maine. We'd like to take a moment to offer our condolences to the friends, family members, and communities of both of these men who have died. Overall, across the state, there are now a total of 48,774 cases of COVID-19, representing an increase of 131 cases since yesterday. Of those cases, 37,660 are confirmed, and 11,114 cases are probable. Cumulatively, 1,635 people have been hospitalized since the very beginning of the pandemic. And right now in Maine, 79 people are in the hospital. 25 of them are in a critical care unit, and 13 of them are on a ventilator. Since the beginning of the pandemic, among our cases, 4,365 have been among healthcare workers. In terms of testing, our 7-day test positivity rate for PCR tests now stands at about 2.18%, and our testing volume stands at 533 PCR tests for every 100,000 people. Antigen testing, returning to antigen testing, where our 7-day positivity rate is at 4.7%, with a testing volume of 138 antigen tests for every 100,000 people in the state. Turning now to vaccines. Overall, Maine has administered 591,727 total doses of COVID-19 vaccine. 369,484 of those are first doses, and 222,243 are final doses. To put those numbers in a little bit of perspective, that means that about 27.5% of the state has received at least a first dose of COVID-19 vaccine, and 16.5% of the state has finished their entire COVID-19 vaccine series. On top of that, if we focus just on those Mainers who are 60 and over, 60s, 70s, 80s, and above, 2 out of every 3 Maine people, 60 and above, has received at least their first dose. 2 out of every 3 has received at least their first dose. On top of that, as folks may recall from late last week, today is the first day that Mainers aged 50 and over can be vaccinated. We are making progress, and today's move to start vaccinating those 50 and over is an effort to continue our forward momentum. But we also know that folks may have challenges accessing vaccine. And that's why I'd like to take a moment to remind everybody of 2 available resources that can help you access an appointment for vaccine and then get to your appointment for that shot. Let's first talk about ways that we can help you get an appointment. The main avenue is through our community vaccination line, the phone number for which is 888-445-4111. This is a phone line for folks who are having a difficult time accessing the various websites. This is not an express lane to getting an appointment. It is merely a tool to help you find or navigate the websites where you can schedule an appointment. Interpretation services are also available. Again, that number for the community vaccination line is 888-445-4111. Now, we know that for many Mainers, getting that appointment is just the first of many hurdles. For many Mainers, getting a ride to wherever you are going to get vaccinated in and of itself presents a challenge. And that's why we are offering rides to your vaccination site. The Maine Department of Health and Human Services can provide transportation for appointments that you may have for your vaccine, for appointments scheduled Monday through Saturday from 7 a.m. to 4 p.m. In order to make an appointment for a ride, please call 1-855-608-5172. You should call at least 48 hours before your appointment to reserve a ride. And when you call, you should have at least two pieces of information ready to go. The first is the date and time of your appointment. And then the second is the name, address, and phone number of the facility where you're going for your vaccination appointment. Again, the number to call in order to book a ride, if you need one, to a vaccination site is 855-608-5172. We urge everyone to take advantage of these resources. If you need, for example, help finding an appointment and making an appointment, or help with getting a ride to your appointment. So with that, I'm going to turn things over to our colleagues in the media. And the first question for today goes to Allison Ross.
Hi, Dr. Shah. Thanks so much for taking my question. So is there one county in particular that has been lagging behind in vaccinations? And if so, do you know why that is?
Well, it's interesting you mentioned that, Allison. I was just taking a look at some of those data this morning. One really important note, there are a few counties that are behind other counties. But when you take a look at the data, which is on our website, on our dashboard, what you find, especially if you focus on the percentage of people in counties who have received their final doses, is that they're not that far away from each other. So the difference between the top county and the bottom county is a couple of percentage points. And when you translate that into populations, it's on the order of hundreds of people, not tens upon tens of thousands. That being said, the counties that we are focused on right now to try to bring them up, there are two in particular, Somerset and Oxford counties. I had previously expressed concern as well about Washington County, but in recent days, they have really brought their numbers up. But we continue to express some concerns about Somerset County as well as Oxford County. Some of it in particular is around just the supply of vaccine that's going to those counties. Folks will see in the vaccine that's going to those counties this week, we've taken steps to allocate as much as we can to vaccination sites in Somerset County, in Oxford County, to try to make sure that they've got as much vaccine as they can so they can get shots into arms. But Allison, I would urge everyone to take a look at the data on our website. When I was scrutinizing it, what stood out to me is not that there are differences in vaccination rates. That is unfortunately going to happen. Not every county can proceed at exactly the same pace. But what stood out to me is that although there are differences, the delta between the top and the bottom was not that large. We're hoping to narrow that even more in the coming days, coming weeks, as we get more vaccine supply.
And speaking to vaccine allocation, is that based on population or is that based on the actual need in that area?
It's based on a number of factors. Population is one of them. It's also based on, for example, for the vaccination sites in the area, how many appointments they have, how much supply do they have on hand, how many individuals within the age categories that we are currently vaccinating are unvaccinated in that area. That's really one of the ones that we zero in on. Within the age category that we're focused on, how many individuals have yet to receive their vaccine? So it's not so much the entire population, It's those 50, 60, 70, 80 plus. That's one of the variables that we use as well.
Great. And then just my final question here. I was wondering what your thoughts were on the AstraZeneca vaccine. I know it came out today that they possibly used some outdated information. So I was wondering what you were thinking about that.
Yep. Well, Allison, let me start by noting that before we make any pronouncements or decisions about scientific policy, vaccination policy, regulatory decisions around vaccines, we should not do so by press release. Doing science policy by press release is not the way it should be. And so my first note about the AstraZeneca situation is that we need to see all the data. It needs to be peer reviewed, published in an open forum, and as well evaluated by expert independent scientists at the FDA. Thus far, all we really have is a press release from the manufacturer and then a statement from the National Institute of Allergy and Infectious Disease that came out early this morning or late last night, indicating that there may have been some reliance upon older data. Without seeing the full complement of all the data, it's really difficult to evaluate this. I'm looking forward to being able to reviewing all of the data, having peer-reviewed scientists do the same, as well as the experts in vaccine regulation at the FDA. I have the same questions that many do. What were the data that were out of date, that were relied upon? Why was that done? How much did that change the eventual efficacy numbers, and to what extent? Those are the same questions that many of us in the regulatory field have. But until we see all the data, I'm going to hold my judgment on it, and so we can look at all the data at once.
Great, thank you.
Let me turn it over to Kevin Miller next.
Great, thanks, Dr. Shaw. First question, if you don't mind just kind of providing us an update now that we're expanding to the 50-year-olds, what, at 50 plus, what are you hearing from the vaccination clinics? You know, what kind of demand are they seeing? What kind of capacity do they have? And then kind of combining that with what you're expecting for vaccine doses in the next week or two. How do you think things will be rolling out for vaccinating folks in that age group?
Yep. Well, let's start with a couple numbers, Kevin. That entire age group of just 50 to 59, so not including those 60 and over, but just the newest age tier, 50 to 59, per the census numbers, is about 197,000 Mainers. But about 33,000 of them have already received a vaccine, perhaps because they are educators or healthcare providers, for example. So we're looking at about 164,000 people in this group that are starting today eligible. Over the past couple of days, over the weekend, I had the chance to catch up with and speak with a lot of vaccine site operators. They have reported a very robust pace of schedules of appointments being opened up and then snapped up. And so we are expecting a lot of demand from this group. I'm encouraging as much demand in this group as I can do on my end as well. So I'm hoping that we can make steady progress through this group of 50-year-olds by opening up as many appointments as possible. We're also starting to hear, we're speaking with my federal colleagues as well, about the projected increases in vaccine supply. And although we don't have our final complete numbers for next week in the state of Maine, based on the early reports I've received from our federal colleagues, we are expecting an increase in our J&J supply, but that increase may not be as much as we were initially expecting. This is not a Maine-specific phenomenon. This is a national phenomenon. There may evidently be some challenges in the supply chain such that although there may be an increase in the J&J supply, it may not be as robust as the one we were hoping for next week. But there is also hope that there may be other increases, particularly a one-time increase in the Pfizer supply. All of that is to say, Kevin, what I'm hoping to do is have a pretty big week and a half when it comes to vaccinating, particularly in this 50 to 59 category. We're already seeing strong demand, and we're hoping for an increase in our vaccine supply. I'm hoping that means we can really accelerate that rollout.
Great. And then you talked a little bit about the kind of the disparities in Somerset and Oxford County. We're also seeing, I saw that Maine Health today announced that they started on a small scale doing some some vaccinations of homebound individuals. And then DHHS also had a pilot project last week in Androscoggin County. We're going out and doing homebound individuals. I guess what's your thoughts on that prospect of kind of getting, especially when we're looking at the 70-plus-year-olds who still have not been vaccinated, and in some of those rural counties, we're still seeing pretty lower percentages of people who have gotten their first dose. So I guess what are your thoughts on how important a role and what do you expect for homebound vaccinations going forward?
Yeah, we're fully committed to it. We know that although, for example, for those 70 and over, there have been a large number of folks who have already gotten their shot. We're at over 80% of those 70 to 79, or if you include 70 and all the way over, 70 and 80 plus, it's 79% who have received their first shot. The question on the table is, what can we do to get that number higher? How can we reach that 21% that hasn't yet gotten their first shot? We are fully committed to going out to folks to bring vaccine to them if it's not possible for them to come to the vaccine. Maine CDC has been working really closely with our colleagues at ODES in combination with community level vaccination providers, such as those who provide home health services. The project, Kevin, sort of has three components. The first is identifying who is a homebound Mainer senior that may be eligible or need vaccination. In some cases, we get referrals from primary care doctors or area agencies on aging. In other situations, we try to identify those folks proactively. So step one is identification. Step two is notification. We reach out to them in a manner that is familiar to them, so they're not getting a phone call from somebody that they don't know or don't trust. And then the third step is the actual vaccination, going out into the field to provide them the vaccine. We're starting that up this week. Thus far, the reports I've heard have been very positive. I want to wait and see how the data look and see how we can improve it going forward. In addition, as we hope to get more J&J vaccine in particular, that will be probably the rate limiting factor in how much we can scale this up. The J&J vaccine is very well suited for this enterprise. It can be out of a frozen environment. It can be used in the field very easily. So as we get more J&J vaccine, we can increase our commitment to this.
And is that going to be a statewide program soon, those homebound vaccinations?
I think the answer yes. The answer is yes, Kevin. But as with so many large scale efforts, we'll probably be rolling it out in stages. We're starting in a couple of areas right now. You mentioned Androscoggin. There are some other areas where we've allocated vaccine for this purpose. So for example, you noted Maine Health doing it. We're working on it as well. And then we'll probably move out in other parts of the state as well.
Great, thank you.
Mm-hmm. Let me turn next over to Amy Brown.
Thank you, Dr. Shah. I have a couple of questions from listeners. Again, the first is someone who has a therapy dog who visits long-term care facilities, and he says he's been fully vaccinated, but he just wants to be sure that there's no way that the dog might spread the virus. Remember early on, there were some reports of some pets that had the virus. So he wondered what you thought about that.
Amy, as a dog lover myself, this has been something I've been focused on, and I'm recalling an instance where I was speaking with the legislature, and if I may, it was then Representative but now Speaker Fecteau himself raised this question, and I resonated with that question as well, because I'm worried about our animals. Based on everything that I have read, Amy, there is not a risk of COVID to our household pets.
Great. And another listener asks if there's any record of anyone testing positive for COVID after they've been fully vaccinated.
Oh, yes. There are individuals who have tested positive and had confirmed COVID even after they've been vaccinated. The vaccines, although they are strikingly effective, are not 100% effective. So it is possible to contract COVID even after you've been fully vaccinated. that is one reason why wearing a mask, even after you've been fully vaccinated, is very, very important.
The people who have contracted it, though, have had the more mild versions of the disease, or have there been
Yes,
severe?
so the vaccines remain exquisitely effective at keeping people out of the hospital, even if they happen to get COVID. And certainly their effectiveness at reducing the likelihood of dying is 100%. So they are still the right thing to do. And indeed, in many of the case reports that have been published nationally, internationally, of cases of people who have had COVID after vaccination, their symptoms have been very, very mild.
Great, thank you.
Let me turn it over to Charlie at Maine Public.
Yeah, hey, Dr. Shaw, thank you. So my first question is about the vaccine availability across the state. I've heard from someone who was shopping around for a vaccine appointment that a lot of places, especially in southern and western Maine, seem to be filled up, but that Northern Lights Bangor site appeared to have a couple openings on multiple days of the week. And so I guess one is just, does the Bangor site, the Cross Center, just happen to be having more of these kind of openings? And does that reflect any kind of broader trends, whether it's vaccine hesitancy in the Bangor region or anything like that?
Charlie, not by my lights. I think there are a number of things going on there. One of which is, although I know that they are opening up, freeing up appointments, they also get snapped up relatively quickly. I've spoken personally with the folks that are operating that site, and they are not reporting systematically that a large number of their slots are going unfilled. The other, though, is that as we've opened up now to the age category 50 and over, adding now 164,000 people in Maine who can be vaccinated, what's been said to me and what I've seen in the data already is that although there may have been a couple instances last week where there were a few sites that had slots that didn't get filled, with this new age category being opened up, we're anticipating pretty robust demand.
Okay. And then with the opening of bars and the lifting of some gathering limits on Friday, I was just wondering, with the numbers of new and daily infections kind of plateauing or maybe even increasing a little bit, if that's given you any pause about going forward with that, the loosening of those restrictions this week?
Not at this time, Charlie. And of course, we're always keeping an eye on the data, not just cases, but hospitalizations, the number of people in critical care, our positivity rate, so on and so forth. So we take a look at a number of those pieces of data, as well as to see if there are any regional trends or areas of particular concern, as I mentioned a little, maybe a week and a half ago in Piscataquis County. But nothing at this time. Indeed, although there was an uptick recently, we have now gone a couple days of being under 200. Today was a decrease. That could change, however. And so what we've learned over the past year of COVID is that some degree of indoor activity can be done, but it's got to be done in a careful manner so that physical distancing remains important. If the activity can be moved outside, that helps even more. Some states have seen a significant acceleration in their cases, New Jersey in particular. We haven't seen that in Maine. And so again, we're always keeping an eye out, but at this time, I haven't seen a reason to pause or reverse course.
Got it. Thank you.
Thanks, Charlie. Over to Jessica Piper at the BDN next.
Thank you, Dr. Shaw. First, I wanted to ask, it looked like Maine had on the Maine COVID site, there's now a place where anyone of any age can pre-register. Can you talk about that? Should people go there and sign up? What should they expect?
Sure. So we are opening up our pre-registration system. We're going to have a lot more to say about this probably in the next day or so, Jessica, but we are opening up the system to allow folks to pre-register. The pre-registration is not for every site in Maine, I should be clear. It is just for those sites that have opted to use the state's scheduling platform. And we're bringing on more and more of those sites as we are opening up the entire scheduling platform. We know that as we move into 50s, 40s, 30s, and so on and so forth, there are going to be more opportunities to get vaccinated because there may be more types of clinics that open up. So the pre-registration is really focused on just those sites that will or will ultimately be using the statewide scheduling platform. It will not be for every single site in Maine. Again, we'll have a lot more details about that, but that is the direction we're going to make sure that places that want to be offering vaccines don't have scheduling as the hurdle that they're facing. And for that system, we'll be able not just to register folks, but also to pre-register them as well.
All right, thank you. And then we had heard from a couple Mainers under 50 who had been able to get vaccinated by using pharmacy quote unquote waste lists, where pharmacies are having a list of people that if they have extra vaccines at the end of the day, they can call. Is that practice endorsed by the Maine CDC? And how are you recommending pharmacies go about administering extra doses if they end up with?
So we have, there is nothing untoward about that practice at all. I just want to be clear, these aren't wasted doses. These are doses that at the end of the day may be left over. And they're recognizing that this is a possibility and recognizing the need to make sure we were providing guidance around this. We put up a document, gosh, several weeks ago that we distributed to vaccination sites across the state. It's also on our website. That lays out the process by which any vaccination site, what they should do if they are approaching the end of the day and have a few doses left in a vial, how they should approach giving those out to folks. They should, of course, look for folks who are already age eligible and then move down a certain set of criteria. And if at the end of those criteria, they can't find anybody, then they should make sure they give it to any willing person such that not a single dose is wasted.
Maybe this is the document you were referencing. I think I found one from early February that was referencing first people over 70, then people 65 to 69. Has there been guidance for like lower age groups than that now that maybe
Yeah, we've updated that document at least once or twice since we first posted it. And the key behind all of that, the overarching principle that motivates that document is that not a single dose should go to waste. And so if after attempting to find somebody who is age eligible or a spouse who may be with them who is not scheduled that day, but has an appointment coming up in a couple of days or weeks, after going through all of those things, if they are still not able to find somebody in the upper tiers to give the vaccine to, they should, as a last resort, give it to any willing person who will take it. And as a result of that, we have had very, very, very few doses in Maine that have gone unused.
All right, thank you.
Let me turn it over to Evan Pop.
Hi, Dr. Shah, thank you. I wanted to ask, so with everyone over 16 becoming eligible for the vaccine starting on April 19th, I'm wondering if the state is worried that with so many people becoming eligible at once, those with more resources and easier access to healthcare systems will be able to get the vaccine faster at the expense of maybe groups that struggle to get access to the healthcare system. And if so, what is the state doing to avoid that type of situation? Sure,
Evan, that's a concern. And that's why two of the resources that I talked about just at the top are, I think, critical to making sure that that doesn't happen. The two principal ways that we can try to make sure that everyone's got access to the vaccines are by one, providing a phone number. So if broadband internet or navigating the internet is not something that's easy for you, our community vaccination line is a way to get access to all of the sites across the state to get scheduling. It's not an express lane. It doesn't allow you to jump the queue. There are no secret appointments available through that line, but it is a way to access any of the other mechanisms by which folks would normally schedule online. The other way we can try to ensure that that gap doesn't open up, that the disparity doesn't show itself, is by helping folks get a ride there. Transportation remains a challenge across the state for so many people. So partly about scheduling, it's partly about getting a ride there. Those are two of the things that we've heard from community groups that could be potential barriers to different groups in Maine not being able to get vaccinated.
And I've also seen a document floating around about pop-up clinics that the DHS is running. Is that another strategy along those lines?
It absolutely is, Evan. We haven't gone live with those yet, but we are in the planning phase. For a lot of groups in Maine, one of the elements that will instill trust is if the vaccine is brought to them and they can be vaccinated with their peers. They can be vaccinated with folks whom they trust in a setting that they also trust. And so that's why we are working with sponsors of those types of pop-up clinics, as well as the teams that can staff them as vaccinators, to mix and match folks up so that if there's a particular group that wants to say, we would love for some vaccine to come on site for us, because we have a community that may not be able to get there, that may not be able to access rides, that is deeply hesitant. We can bring the vaccine to them, working with different community partners, be it EMS clinicians, public health nurses, other groups that are willing to go on site. You're right, Evan, that's yet another way that we can try to bridge that gap even further.
And I'm wondering, with the eligibility opening up, is that going to apply in prisons and jails as well? Will everyone kind of over the age of 16 in those facilities also be eligible starting April 19th?
So far as I'm aware, yes. I will check with the Department of Corrections, but that is our planning assumption. And as it turns out, Evan, I know this is a topic that you've written about and covered. We are actually right now, or starting, this week, the Department of Corrections is conducting vaccinations for individuals in the Maine state prison system who are eligible by their age. So that is underway this week as well.
Great. And just one last question that I received from a reader who emailed with a story about her over 65-year-old husband getting one of those extra doses that you were talking about at the end of the day as a walk-in at Walgreens in early March. But subsequently, he's been unable to schedule an appointment for a second dose, either online or over the phone with Walgreens. Apparently now that Walgreens is kind of focused on vaccinating teachers, which he's not a teacher. And so they've called 211, which hasn't worked. They've tried to go online at that Walgreens site and called that Walgreens on the phone. That hasn't worked. And I'm curious if this is a problem you've heard before and what you would recommend for this person to do to get their second dose.
I've heard that occurring in two or three instances. It's not something I've heard as being widespread, although it certainly could be. We've flagged it for Walgreens to make sure that they are aware of this. What we recommend is reaching out to the store so that they can get an appointment. But we've also communicated to providers across the state that they should also be equipped and ready to deliver second doses to individuals who may have gotten their first dose elsewhere, but are simultaneously having challenges getting their second dose at that same location, perhaps because of the reason that you mentioned, or perhaps because of allocation challenges. I won't go through the math as to how this happens, but what can happen sometimes is that a facility may be allocated a number of vials as second doses, but not everyone shows up for their second dose. So they may administer first doses out of that second dose allocation, so nothing goes to waste. But then we've got to figure out a way to get that person their second dose, because it came from I'm not going to go into it more, but this is a logistical problem. It's something that we have been working on. It's something that we've encountered in general, and that's why we've given direction to vaccination sites to be prepared to deliver and administer second doses to somebody, even if they didn't get their first dose at that location.
Great, thank you.
Mm-hmm. Over to Stephen Porter next.
Thank you, Dr. Shaw. I had just a couple of follow-up questions on what Ms. Piper was asking about earlier. So I understand that more information is to come with this pre-registration and appointment system. I just wanted to confirm, when was the soft launch, and is the site actually operational at this point?
The site is operational. However, we are still working to bring on the providers who will be utilizing the back end of that for their own scheduling. We put the link up just a few hours ago. And so although pre-registration is open, there isn't a registration component yet that accompanies it. That is forthcoming very, very soon. And so again, pre-registration is there. We're going to have much more to say about it, But I want to be very clear. This is not necessarily statewide pre-registration. So registering on that site does not mean you are in line for any and every site in the state. It will only be for those sites that ultimately opt to use the state scheduling platform. There may be providers who say, we are good with the system that we have, we're going to stick with it. In that case, the pre-registration on our site will not necessarily make them eligible for other sites who do not use our actual registration platform. Clear as mud, Steve?
I think that that is helpful. Thank you. I did want to ask, I know that our neighbors in New Hampshire launched their state-based centralized registration system last week. And there were some challenges at the beginning of this week, but it is live. Is this comparable? Is what has just been soft launched, is this comparable? Is this the centralized registration system that we've been talking about for a few months, or is that still a separate goal?
No, what we've seen, and I think what the vast majority of states have seen, is that very, very large providers have opted to stick with their own scheduling platform. And I'm not aware of any of those large providers in any state who have said, we're going to abandon the way that we're doing business and undertake a massive multi-million-dollar IT project to shift over to something else that's out there. Right now, the goal is to get as many people registered as quickly as possible. So this platform that we are soon will have much more to talk about will fill in a gap. It will not be meant to supplant existing scheduling platforms. It will rather fill in a gap for sites that would like to be doing more vaccination, but are dissatisfied with their own existing scheduling platform, or for places that would like to come online that have no scheduling solution whatsoever. So it will not be meant to replace or displace or supplant existing providers who have already developed a lot of skill and a lot of fluency with their existing platform. Some states have, New Hampshire, for example, have sort of gone in and said, use the statewide scheduling one. But I think, as everyone is aware, making those big IT shifts in the middle of a pandemic, when the system is generally working okay, that's fraught.
Understood. Thank you.
Let me turn it over to Jackie Mundry at News Center.
Hi, Dr. Shaw. Thanks so much. I just have a couple questions. A number of schools in York County have recently announced some COVID-19 cases with students and staff quarantining or isolating, and it looks like some of the students in York County may have gone to a wrestling match in New Hampshire, which has been deemed an outbreak. Is there a connection there? And as far as contact tracing that, is the Maine CDC doing that, or does that go through New Hampshire?
Yep. So Jackie, we are aware of that wrestling event down in New Hampshire. We are looking into the extent to which people in Maine may have been exposed, and to the extent they were, whether if they have COVID, it was linked to that, or if it was linked to other exposures in Maine, hence the contact tracing piece that you mentioned. At this time, we haven't discovered any definitive cases, but it's also relatively soon in the transmission cycle. That linkage may not really become apparent for several more days now.
And then, so obviously vaccines are being distributed. We're talking about that a lot, and some restrictions are loosening starting on Friday. Is that, maybe I won't say encouraging people, but are people letting their guard down and traveling to different states like New Hampshire? Are we seeing more of that?
Jackie, could you repeat the latter half of your question? You said, are people letting their guard down, and then what?
Are people letting their guard down and, more willing to travel to different states now that restrictions are loosening?
Well, I can only speak as to the national data, and what I've seen at the national level, what's been put out by TSA and others, is that travel across the country is up. Air travel in particular seems to have risen just in the last few weeks. The extent to which that has been a factor here in Maine, it's difficult to say whether more Mainers are traveling or whether more folks are coming here. I haven't seen those specific data, but I think the bottom line here, Jackie, is that although we're making progress, although we've delivered now probably by the time we talk again, 600,000 doses of COVID-19 vaccine, we're still in this, right? We're still having over 100 cases a day, reporting 2 deaths alone today. we are not out of the woods yet. And so to the extent folks are relaxing their guard, stopping wearing masks, avoiding distancing, now's not the time to let go of those things. Now is the time to stick with them, because although COVID numbers have come down, that is not an irreversible trend. They can come up just as easily or quickly as they've come down. So even if if you're not vaccinated yet, but you're looking forward to it, and don't let down your guard in the interim period. The more we keep cases down right now, the more effective and the more quickly we will come out of this on the back end. We're all expecting a great summer. And the more we get vaccinated and the more we keep cases down, the better and the more quickly that summer will arrive.
Thank you.
Over to Patrick Whittle.
Thank you very much, and happy Tuesday. A couple of things. The first of which is, so today is a big day. Also a big day is April 19th. How confident is the state right now that we really are going to get to everybody 16 plus on that day, because it's less than a month?
Yeah, Patrick, based on what we see, there are three things that give me encouragement. Number one is projections of increasing vaccination supply, perhaps through the balance of this month, but also throughout April. Number two is the headroom that we have in Maine. What I mean by that is, over the past 3 or 4 days, I've taken I've had the opportunity to speak with hospitals, vaccinators, vaccine sites across the state. And I've asked them, okay, here's what you're doing right now. You're doing X number of doses per week, but what's your theoretical maximum, right? How far are we between where we are right now and how much you could be doing at the top end? How much headroom do we have? And the answer almost uniformly is that virtually every site in Maine could be doing a lot more than they are now if we had the vaccine. That means, of course, that when we get the vaccine, we can increase our throughput as a state every single day by that much more. And then the third thing that I'm encouraged by, Patrick, is the rate that we've already gone thus far. Again, as of this morning, for those Mainers 60, 70, 80 plus, 2 out of every 3 of them has gotten at least their first dose. I'm expecting a similar velocity in the age category of those 50 and over. And then that gets us into a very good position on April 19th to open up to the rest of Maine. So I've got confidence around this based on some of those factors. If any of those things changes, then we'll plug that into the calculator and see what it takes us. But for now, I'm very encouraged.
Okay, good to know. Related but unrelated. The Portland Press Herald reported today that cases of influenza and in fact even Lyme disease are down this year. The correlation with influenza is pretty obvious. Mask wearing, less physical interaction, that'll do it. But is there any correlation between steps people have been taking and the downward trend in Lyme disease? Because that's the thing, people get outside, and people have, for the most part, been outside.
Yep, there are 2 hypotheses that are at play with respect to the decrease in Lyme disease cases. Number one is that it's possible that some folks may have just been accustomed to being indoors, notwithstanding lots of folks saying, get outside, enjoy the fresh air, you can be physically distanced and have a low risk. There are some folks who have looked at things like cell phone data, not specific to Maine, nationwide here, and who have observed that folks really did just stay inside a lot. But that's a hypothesis. The other hypothesis, though, Patrick, is that there might be ecological or climatological factors based on how weather patterns may have affected tick activity, which may have impacted or reduced the rates of Lyme disease. Either way, both the reduction in Lyme disease as well as the reduction in influenza, they're both good news in a year where it's been tough to find good news.
So we should, when we do get out there this spring, we should keep pulling our socks up. That's like more or less the bottom line here.
I went out with my family and our dog for a hike on Sunday, and although we're not quite yet into tick season, we were really careful to make sure we were covered up. As soon as we got back, we checked the dog, for any ticks, things like that nature. So, yep, the fact that last year was a favorable year for Lyme disease doesn't really tell us anything about what this upcoming year may be. So those same precautions, wearing insect repellent, keeping your socks up, tucking your pants into your socks, reducing open skin, all of those things, checking yourself afterwards, those are going to be really important this year.
Okay, terrific. Thank
you. The last hypothesis that I will mention is that, again, these are all hypotheses. I just want to stress that they are hypotheses, is the possibility that some folks may have gotten Lyme, but mistaken it for COVID symptoms, because there is some overlap, not a lot, but some overlap between Lyme symptoms and COVID symptoms. And folks may have said, this is just a mild case of COVID, I'm okay. So there's a lot of different hypotheses. As with so many things epidemiological, it's usually not until after all the data are in and all is said and done that we really have a sense of what was going on at the time.
Correct me if I'm wrong here, but I believe yet a fourth possibility is that there are some people who just didn't seek treatment because of how much people were avoiding emergency rooms and things like that.
It's entirely possible. Although, during peak Lyme season, that was at a time when cases in Maine were low. So hard to know, but that is a possibility. We've seen across the healthcare spectrum, there was an avoidance or a reluctance to seek healthcare, whether it was for heart disease, heart attacks, strokes, or potentially even for Lyme disease. So that's a possibility as well. Let me turn it over to Morgan at WABI.
Hi, Dr. Shaw. Hope you're doing well. Thank you for taking my questions today. My first one is a quick clarification that I have a couple of questions. A little bit ago, you said that Maine has a small unused, there's been a small unused portion of vaccine in Maine. Can you tell me?
Oh, yeah. I mean, we're talking like single digit, like literally, like I hear about a single dose that didn't get used at one. I mean, it's almost unheard of in Maine, that, and nationwide, I should say as well, based on US CDC data, that a dose actually gets wasted. That is to say, the vial is open, the clock starts ticking, and not every single dose in that vial gets used. It occurs so infrequently that if it were to occur, I usually get a note about it, but we're talking a couple of times, over 600,000 shots.
Okay, that's great. Can you talk about some percentages for me, if you have that with you, the number of educators, percentage of Maine educators, 50 plus, some of those groups, if you have any of that data?
Sure. Morgan, I just want to go back to the wasted doses here. I just want to underscore that where we're talking about our doses that the vial has been open for and they have to be used within a certain time period. And one reason why we have had vanishingly few of those instances is because we have a lot of reliance on these large-scale sites. These large-scale vaccination sites can, throughout the course of their day, gauge how many people they've got left and literally plan out the last few hours of their clinic so that by the time the last person gets in line, they have metered out exactly how many vials and doses they need so that when that last person gets their shot, they are good for the day. That's one reason an actual dose that goes unused has been exceedingly rare in Maine. And that's just one of the many benefits of the larger scale sites. Let's talk about, so Morgan, you asked first about educators. That has been a difficult number for us to get a good sense of. As I've mentioned before at these meetings, we don't ask for someone's occupation when they go to get vaccinated. We try to make the process as quick as possible because this is mass vaccination. So we don't ask about someone's occupation, which makes it difficult after the fact to know how many educators have been vaccinated. Profession or occupation is not one of the US CDC's data elements that states are asked or required to capture. So we're working to see if we can find other ways to gauge what percentage of educators and childcare workers in Maine have gotten their first dose through things like surveys. We're working on that now. I don't have those data with me quite yet. I think the other you asked for, Morgan, was it those 50 plus? Was that what it was?
Yes.
Okay. What specific data do you want to know? What percentage of 50 plus have gotten their first dose? What specific variable?
Yeah, first dose is
okay. So I'll give it to you in two different avenues. The first is for those 50 to 59. 17% of those in their 50s have received their first dose. But if you look at all Mainers 50 and over, so 50, 60, 70, 80, for example, and over, the percentage who have received their first dose is 50%, 50.
And I also had a question, Dr. Shaw, about breastfeeding women and expecting pregnant women and the vaccine. Can you talk about your suggestions, recommendations for them? If they are vaccinated, will the baby in turn have antibodies?
So that, it's Morgan, just a couple of days ago, there started being some publications in scientific journals about this exact issue. And the answer is that yes, if a pregnant or a breastfeeding mom gets vaccinated, their baby will then have the protection that's afforded from the mom's antibodies. That's a good thing. And so the recommendation from the US CDC is that although the vaccine was not specifically tested in pregnant women because of typical vaccination study protocols, there's now been enough data amongst pregnant women who have gotten the vaccine to suggest that it is both safe and effective. And so although we don't have a strong recommendation on that, the US CDC has recognized the safety and efficacy of the vaccine for pregnant women. I recommend that pregnant women check in with their doctor to make sure that the vaccine is right for them. There's no reason why it shouldn't be, though.
And for those who are breastfeeding, your recommendation?
The same thing, the very same thing. There's no reason why they should not be vaccinated.
Okay, thank you so much.
Mm-hmm. And the last question for the afternoon goes to Brad Rogers. Brad, over to you if you're still on. Okay, well, perhaps we already addressed what Brad was going to ask. So I'd like to just take a second to thank everybody for your time this afternoon. And just a reminder about two resources that are available. The first is to help you schedule a vaccine. It's a phone number that you can call if scheduling online is not something that's available to you. And that number is 888-445-4111. And the other option, or other resource, is the ability to get a ride. If you need a ride to your vaccination site, you can call 855-608-5172 at least 48 hours before your appointment, provided your appointment is on a Monday through Saturday between 7 a.m. and 4 p.m. We are trying to do everything we can to make vaccines not just available, but accessible as well. We're going to continue to do that so that we can get as many Maine people as vaccinated as quickly as we can. As I mentioned a moment ago, we all want that return to normalcy. We all want this summer to be much unlike the summer of 2020. And vaccination is our pathway to getting there. We look forward to providing you more updates in the future. I look forward to checking in with everybody again on Thursday. In the meantime, thank you for joining. As always, please be kind. Take care of one another. We'll talk again soon.